I'm Dr. Richard Singer. I'm a kidney specialist and I also treat obesity. And I'm going to talk about what is chronic kidney disease. So most people have two kidneys, that's normal. They're each about 11 centimetres long, so maybe about that big, maybe about that wide. Although they're quite small, they do a very important job, which is mostly to get rid of toxins in the body, keep the level of salts in the body about right, keep the water level about right, and get rid of acid. As well, they release a couple of hormones, one of which looks after calcium levels in the body and is related also to bone strength, and the other one looks after your blood count and helps you avoid getting anemic or having a low blood count. So what is chronic kidney disease? Well, chronic means long term, so it means something that you've had for more than 3 or 4 months, and conditions like that don't usually get better. When you have disease in the kidney, it means that they're not doing their job properly. So the main thing we look at is their job filtering the blood of toxins. And if they're not filtering enough, the toxin levels build up. Now generally, you don't get any symptoms from that until you've lost 80 or 90% of your original normal kidney function. And when you have lost about 90%, you might start to get symptoms like fatigue, itching, nausea, loss of appetite, and that type of thing. And as well, you can notice fluid retention, where initially your blood pressure goes up, and then as you retain more fluid, you often notice swelling in the legs, and sometimes you'll get excess fluid in the lungs, causing shortness of breath. In some cases, the kidneys will filter the blood normally, so the toxins aren't building up, but the filter itself has become too leaky, and it lets through things that it shouldn't. And those things are blood and, in particular, protein. And losing a lot of protein in the urine actually causes further damage to the kidney themselves. When the kidneys are filtering very poorly and the level of toxins build up, you can run into difficulties with heart function. That's the shortness of breath that I mentioned. There's a much higher risk of breaking bones, 6 to even 12 times the risk of having a hip fracture if you have severe kidney disease. And you can have problems with muscle strength, causing weakness. Now, chronic kidney disease, as I said, it usually can't be reversed. Most chronic processes in the body are difficult to reverse, but what we can do is try to slow down the loss of function. And in order to do that, we need to understand why the kidneys become sick. For most kidney disease, unfortunately, we don't actually know why. We might say it's due to diabetes or it's due to an inflammation in the kidney, but why did one person get that problem and another one who otherwise seems much the same did not? And that's what we need to understand in order to work out how best to treat it.